Welcome back with me, Melissa Ong. If you didn't know, 2 cases of the deadly Nipah virus in India has been reported, with at least 190 people quarantined, which has prompted authorities in several countries, including Malaysia, Singapore, Indonesia, Thailand and Vietnam, to strengthen airport screening to prevent its spread. While the WHO has noted that the risk of the Nipah virus spreading remains relatively low and that none of more than 190 contacts of the 2 infected individuals have tested positive or developed symptoms. The question is, how worried should people be, and what do we really know about this virus? Now, to help us understand more about the Nipah virus, we are joined by a molecular virologist from Monash University, Malaysia, Associate Professor Dr. VINOD Balasubramaniam. Doctor, thanks for joining us. Firstly, can you briefly explain what the Nipah virus is and why the World Health Organization classifies it as a priority pathogen?
Thanks for having me, Melissa, today. So in simple terms, Nipah is a zoonotic virus, right? So it means that it can jump from animals to humans, right? With fruit bats or flying foxes being its natural reservoir, okay? Now, people can be infected through direct or indirect exposure to bat secretions, consumption of food, contaminated by bats, contact with infected animals, and certain settings, close contact with an infected person, right, through bodily fluids. In particular, in caregiving or healthcare environments, hospitals where there are exposures, right, respiratory secretions, bodily fluid can occur. There are a couple of reasons why WHO classifies Nipah as a priority pathogen or possible disease X candidate, right? It has combination of possibility of causing severe diseases, right? It has produced outbreaks with high fatality rates, right? Now, we are looking at somewhere between 40% to 70% mortality, depending on the context and case, right? So, and the most important thing is that it has no licensed vaccine or specific antivirals that work in the current routine use, right? So it is a priority pathogen according to WHO.
Now, Doctor, thanks for that clear explanation. Nipah was first identified, I understand, in Malaysia in 1999. Now, from then until today, what key lessons have scientists learned about this virus?
So, as an introduction, Nipah got its name from the Kampung Sungai Nipah in Negeri Sembilan when the first outbreak happened. Now, I would say that Malaysia is actually an instructive example to the world, right? The 1998-99 outbreak showed that how ecological disruption and farming interfaces can align to create a crisis. And it helped to cement what we call now One Health perspective. What is One Health? Human health is inseparable from animal and environmental health. So it's a combination of all these factors. But the most important important scientific and public health lesson is that outbreaks can be stopped when systems recognize cases early and apply sustained reforms than temporary fixes when the outbreak happened itself, right? Apart from that, we have now, methods of detections, based on PCRs, antibodies from the first time the outbreak, happened in Malaysia.
Now, this virus obviously is all over the news on platforms like IG, and you can read it on news. And I'm sure our viewers are curious to know, what are the early symptoms of Nipah virus infection, and why can it be difficult to actually detect or diagnose in its initial stages?
Now, this is where we need calm clarity, because symptoms are central to early action, right? Now, Nipah often starts off with non-specific flu-like symptoms. You'll have fever, headache, muscle aches, fatigue, sometimes sore throat or vomiting. At this stage, right, it can look like many common infections, particularly similar to influenza, which is why early diagnosis is challenging. In some patients, illness progresses to encephalitis, right, inflammation of the brain, and clinically it may present as drowsiness, confusion, altered consciousness, seizures, and in severe cases, coma. In some outbreaks, respiratory diseases is also prominent: cough, shortness of breath, pneumonia, and occasionally severe respiratory distress, which is what we saw in Bangladesh, right? Now, the incubation period is somewhere to 5 to 14 days, and sometimes can be longer, right? Now, the difficulty is not that doctors can't recognize severe diseases. It's that early Nipah can resemble many illnesses. That is why the most protective phrase for healthcare setting, right, including Malaysia, is that recognize early and isolate safely. Symptoms plus exposure history is very, very, very important. Not only symptoms, including exposure history, right? And the overall, step can protect patients, healthcare workers, and everyone in the facility.
Now, Malaysia's Ministry of Health has begun targeted screening of travellers from higher risk countries such as India and Bangladesh in the airport. And we've also seen similar measures in countries like Thailand and also Indonesia. From a virology perspective, are these precautionary steps appropriate given the current risk level, Doctor?
Definitely. I would strongly agree that they are really appropriate, right? Where they are risk-based and connected to strong downstream preparedness. For the current event, in West Bengal, WHO reporting describes that 2 lab confirmed infections in healthcare workers and assesses the likelihood of spread beyond the affected area, right? Including international spread across the borders is very low. Now, that is a measured assessment, and it is important that the public hears it clearly. The low risk does not mean ignore, but it means not panic, right? So it's important to visualize and to be vigilant.
Now, I'd like to understand, Doctor, why are countries like India and Bangladesh considered higher risk for Nipah compared to many other regions?
It comes down to ecology and human-animal interface, right? The exposure. Now, we know that fruit bats are widely distributed, but risk concentrates where there are repeated opportunities for spillover, where there is contact, right? In parts of South Asia, past outbreaks have been associated with, for example, consumption of certain fresh products, fruits that have been contaminated by bats, right? It can be dates, and those exposure routes can recur seasonally whenever it's, fruiting season. Now, once a case occurs, the next determinant is what happens in households and hospitals. Nipah can transmit, as I said before, through close contact. So close caregiving and healthcare settings, right, where exposure can be intense and prolonged are very, very important. Now, these can generate short chains of transmission, right? So that is very, very dangerous, yeah.
Now, during an outbreak like this, Doctor, the risk of misinformation is very high, which can cause widespread concern among the public. And we saw this during the COVID-19 pandemic. Now, what is the single most important message you would like the public to remember about the Nipah virus?
So as a conclusion, right, now we have learned our lessons from the previous pandemic. My message is, be informed and vigilant, but not fearful. Do not cause panic. Nipah is serious because it can cause severe disease. It can cause high fatality in outbreaks, but it does not typically spread efficiently through casual community contact, similar to COVID or influenza, right? Outbreaks are often containable, where there is early recognition and robust infection prevention and control. And I want to add one last pandemic lesson from COVID-19. Preparedness is built during quiet times. Okay, a small cluster is strategically important, not because it predicts pandemic, but because it reminds us to keep surveillance integrated, diagnostics ready, and hospital consistently prepared. It's very, very important that we start early and not wait for the next pandemic.
Well, wise words, Dr. VINOD. Thank you for sharing and helping us understand the Nipah virus and the precautionary measures we should take. We look forward to speaking with you again. Thank you, Doctor.